Coma is a state of prolonged unconsciousness during which a person is unresponsive to the surrounding environment. Coma can result from a variety of problems, such as traumatic head injury, stroke, brain tumor, drug or alcohol intoxication, or underlying illness, e.g., diabetes or an infection. The Glasgow Coma Scale is a scale for assessing the degree of consciousness, especially after a head injury. The scoring is determined by 3 factors: amount of eye opening, verbal responsiveness, and motor responsiveness. The test score can function as an indicator for certain diagnostic tests or treatments and for predicting the duration and ultimate outcome of coma. The Glasgow Coma Scale was developed for adult patients. The pediatric version is used to assess the mental state of child patients. Like the adult version, the pediatric Glasgow Coma Scale is composed of 3 tests: eye, verbal, and motor responses, but the individual verbal and motor responses differ from the adult scale to accommodate children. Inclusion terms in subcategories R40.22 Coma Scale Best Verbal Response and R40.23 Coma Scale Best Motor Response clarify the usage for pediatric patients 2 to 5 years of age and for those under 2 years of age. Code R40.20 Unspecified coma may be assigned in conjunction with codes for any medical condition, except for neonatal coma P91.5 and coma in diabetes E08E13 in hepatic failure K72, or in non-diabetic hypoglycemia E15. The coma scale codes in subcategories R40.21 through R40.24 can be used in combination with traumatic brain injury codes. These codes are primarily for use by trauma registries. Coma scale codes should be sequenced after the diagnosis codes. 1 code from each subcategory, amount of eye opening, verbal responsiveness, and motor responsiveness, is needed to complete the scale. The 7th character indicates when the scale was recorded, e.g., in the field, at arrival to emergency department, at hospital admission, 24 hours or more after hospital admission, or unspecified time. The 7th character should match for all 3 codes. At a minimum, the initial score documented upon presentation at the facility should be recorded. This may be a score from the emergency medicine technician or documented in the emergency department. A facility may choose to capture multiple Glasgow Coma Scale scores, if desired. Assign a code from R40.24, Glasgow Coma Scale, total score, when only the total score is documented in the medical record. When the documentation provides individual scores, 1 code from each subcategory. R40.21 through R40.23 is assigned to complete the coma scale. Code R40.244 is used to report other coma, without a documented Glasgow Coma Scale score, or when there is only a partial score reported. Similar to the codes for Glasgow Coma Scale individual scores, subcategories R40.21, R40.22, and R40.23 codes for the total score, subcategory R40.24, require a 7th character to indicate when the scale was recorded. If multiple coma scores are captured within the first 24 hours after hospital admission, assign only the code for the score at the time of admission. ICD-10 CM does not classify coma scores that are reported after admission but less than 24 hours later. Code assignment for the coma scale may be based on medical record documentation from clinicians who are not the patient's provider, i.e., the physician or other qualified health care practitioner legally accountable for establishing the patient's diagnosis, because this information is typically documented by other clinicians involved in the care of the patient. For example, an emergency medical technician often documents the coma scale. However, the associated diagnosis must be documented by the patient's provider. If there is conflicting medical record documentation, either from the same clinician or from different clinicians, the patient's attending provider should be queried for clarification. Occasionally, a patient is put in a medically induced coma. This type of reversible coma is induced with drugs to help protect the brain from swelling by decreasing blood flow as well as the metabolic rate of brain tissue. Do not report codes for unspecified coma or for individual or total Glasgow coma scale scores for a medically sedated patient or a patient with a medically induced coma.